Hi everyone, I'm Jenny Rogers, and today we're going to be talking about what we do as soon as we get home with our new little baby. So, right after delivery, what we want to do between right after delivery and before we go to our 6-week appointment follow up with our doctor. So, in reality, a lot of us try to wait until that 6-week appointment to be cleared for exercise, when in reality, this is too early to be getting back into things like running, jumping, doing exercise without any precautions or limitations. But it is far too late to start doing any type of movement or just gentle exercise in general. So I want to just give you a couple of tidbits and things to know before you actually go into that 6-week appointment. So when we come home, I like to follow a rule called in and around bed for those first 3 weeks. So that first week, we want to try to be resting as much as possible. Your body is recovering, it is tired, and it has to put in all of that energy just to keep baby alive for that bit. So hopefully you have some type of support system that's able to allow you to rest while they do some of the cleaning and some of that cooking. Because that first week, we really just want to focus with being in bed. First week, doing things like breathing, practicing deep breathing to reconnect our pelvic floor and our breath with our body to improve healing and restoring those tissues, just giving them as much rest as possible. We can also be doing gentle core activation. So not doing sit-ups and crunches or anything like that, but just practicing drawing in our abdominals and doing a little bit of a brace. So you're not sucking in up, but you're trying to draw abdominals in, holding for 10 seconds at a time and rest, right? So you can just practice reactivating that core. And then you can also be doing a little bit of glute activation where you're lying in bed and then you are just digging your heels into the ground. No lift, but just digging heels to do a little bit of a squeeze. Practicing taking pelvis and doing a little bit of a tilt with it. So we're just starting to reconnect core, glutes, body, and brain. Whenever you're getting out of your bed to go to the bathroom or if you need to shower, try to avoid getting up like this, because that is more of doing a sit-up or a crunch. That can put a lot of abdominal pressure down towards pelvic floor. And then especially if you have a C-section, this is not going to be a fun way to get out of bed. Try to roll to your side and then push up to get out. Okay, you can also hold a pillow at your abdomen if you want to protect that incision just a little bit more. Can feel like a gentle hug to it. In the second week, I'm okay with doing more things where you're walking around just your room, a little bit around the house, because we're trying to be in and around the bed. Around 3 weeks, I'm okay with doing more movement throughout the house, walking for about 10-minute periods at a time. And again, the whole time you're practicing doing deep breathing, gentle core activation, gentle glute strengthening. Things to be mindful of, because we can't avoid doing all different types of activities because we have a baby to take care of. But there's ways to be mindful of how we take care of that baby. So before pregnancy, we stand in a position with our abdominals, our diaphragm stacked underneath our pelvis. And then during pregnancy, we start moving into this position. As belly starts getting bigger, we start arching our back more. And this cuts off our glutes and cuts off our abdomen and just puts strain on our back. And then after delivery, we tend to stay in this position because belly makes an excellent shelf just to hold baby. So what I want you to practice on whenever you're going to be walking around the house is taking ribs and stacking them back over your pelvis. So trying as hard as you can to stand up straight while you hold baby. As well as when you're standing here, try to avoid popping your hip out to the side as a nice little shelf to hold baby. This is going to create some muscle imbalances throughout your body and can create aches and pains later on. So as much as you can, try to stand up straight, thinking about bracing that core some to give your back more of support. Okay. Other things you can begin to work on early on is some mobility for your upper back, some stretching and some strengthening. So on hands and knees, you can do cat camel, where you're rolling back up and rolling down. This is going to be good mobility for your pelvic floor and your upper back, doing at least 20 of these. Okay, our upper backs tend to get stiff because we hold baby in front all day long, whether it's just for holding or if it's for breastfeeding. So we want to do things that encourage opening up our chest, okay, bringing it nice and back. And before that 6-week appointment, we can also begin walks, longer walks around 4 weeks, trying to start with 10 minutes and then the next week doing 15, working our way up to around 20, 25 minutes at that 6-week appointment. And we can work on thinking about how we're standing when we're getting up and off of a couch. So if we're sitting on a couch, we want to those first 2 or 3 weeks, we can use our hands to help push us up and stand. And then when we sit back down, we think about taking hips back and down to get a little bit better glute activation. Okay. And with baby, you're here and you're trying to practice that same position, coming up. And if you're sitting down, coming down, and do a little bit of an exhale with your motions. Exhale up and exhale down. Doing an exhale helps your pelvic floor muscles do a slight bit of a contraction so that they can better support you through those motions. So if you're going to be lifting anything heavy within these first 6 weeks, I tell people exhale with exertion. So if you're going to be lifting your laundry basket, exhale whenever you lift. So we're coming down onto the ground and then exhale. Coming up. Okay. If you're going to be picking up baby, or if you're going to be picking up toddler, think of more of a hip hinge and then exhale as you pick up. Good. All right. Things to know is that it is normal to have a little bit of bleeding for 8 to 12 weeks postpartum. If the bleeding becomes more than just a couple of drops, if it's really skyrocketing up, that is something to mention to your provider prior to, but a little bit of bleeding is normal before that 6-week appointment. So nothing to be scared of, just something to be aware of. Okay. So hopefully these little tips and tricks of how to get out and into bed and how to pick up baby and hold baby is something that can be helpful as you move forward with this process. All right. You're ready to take baby home. Thanks for listening.